Today my topic, Dr. Sathya given to me is a Wetlab. Okay, so I think everybody know about the Wetlab, a place for you to cut, suture, whatever. Okay, so we talk about Wetlab. When we want to talk about Wetlab, right, there are some serious topics. We talk about the surgical training, basically one part of the surgical training in the ophthalmology. Then we talk about the advantages, how to set up the Wetlab, how to maintain of the Wetlab. Yeah, but I believe after talking all these things, the only thing I can achieve is to induce a migraine to you so they can have MC next week. So what I'm going to do is a very simple things. We're going to tell you what is a Wetlab and then why you need to do Wetlab. That is, I think, the most important thing for you to understand why the Wetlab component is quite important for your career to become a surgeon in the future. And at the end, when, where, and also who should you approach when you want to go for your Wetlab sessions. And at the end is a how. Okay, just answer all these questions only. Okay, when I talk about wet lab, then you're wondering why we call it a wet lab and also is there a dry lab? Okay, so we are not talking about all the definition over here. Basically, wet lab means that a place that you are handling with the not only fluid that is called as a wet, anything that you're handling with the tissue, biological problem, material. The most important thing is a wet lab is an environment basically to protect you and protect other people because whatever they use in the lab is something that you need to have a proper disposal. Okay, for example, the needle, the suture, the tissue that you use, you cannot just simply throw in the dustbin. No. So that's why there is an environment for you to practice your surgical skill. So the other thing is a dry lab. Dry lab basically you not involve all this material. Okay, you're basically involving just a computer, something for you to analyze. Okay, so it's not so relevant in our field, but it's getting more relevant now because we have actually something called as a simulator. When simulator come in, not in our hospital yet, but soon, okay? So you have the virtual reality, augmented reality, all these are by computer based. You are not involving anything by just some gadget and also computer. So we basically can call it as a one type of the wet lab, or some people call it as a dry lab because it's purely computer based, okay? So this is our wet lab in a HUKM department, okay? It's located in the department, not in the clinic, okay? So very nicely arranged, okay, in the picture, okay? But the reality is always different from the picture, okay? So sometimes when the wet lab is not fully utilized by any of you, then sometimes when you go inside the wet lab, just when you pass by, have a visit, you can sometimes see the surprise there. Either you can see a rabbit jumping around for the experiment. Sometimes you're lucky you see maybe a monkey there, okay? But it's supposed to be a nice, but you can always change back to this kind of orientations for you to practice your microsurgical skill, okay? So the next question is why you need a wet lab? Okay, so basically most of you at the end, you want to be a surgeon that able to operate on the patients, okay? Our eye is so small, so we not need 2 to 3 hands to operate on one eye, okay? So one pair of hands is good enough. So before you become a solo surgeon, okay, you'll go through the surgical training. I think you all should aware that this is something like a learning curve. The process of learning is quite standard, okay? First of all, you have some theory, some knowledge, okay, go inside your brain, you know what the step, then you remember. Then the next one, you go to your hands-on, okay? So when hands-on started, then you definitely will not straight away go to the patients. That's why wet lab, you have an important component over here. Before you go into your patients to have so-called the hands-on, in the wet lab, can you have a hands-on experience, okay? So when you're familiar with the wet lab, then only you go to the hands-on to the patients. Even to the patient also, we will start with some guidance by your seniors or your lecturer, step by step. When you're able to perform the surgery by yourself, you still need to do it under the supervisions, okay? So at the end, you're familiar and become confident and so-called the competent surgeons, then you can do it without any supervisions, okay? So you can see the wet lab component is something that you need something preparations. You don't go to wet lab just nothing, okay? You should have your knowledge, okay? You should know already, read some books, okay? Watch some videos, okay? And get some tips from your senior before going to the wet lab so that you can utilize the session in the wet lab. The wet lab is something that you need to utilize before going to your patients. So why wet lab is so-called helpful? Basically, it's a risk-free environment, okay? So you have no risk to other people, okay? You may risk yourself, you may poke the finger on your own finger, whatever, okay? That one we're not so worried, okay? But the most important thing is experience for you to flatten your learning curve, okay? Microsurgical procedures, okay, you always require a learning curve, okay? The most common surgery like phaco emulsifications, everybody should know that. The learning curve itself is not long, but it's quite stiff, okay? So the lab should be able for you to flatten your learning curve so that you'll be more earlier to have a favorable outcome for your patients. The important thing is you'll be able to perform a safe surgery. You start the first few cases in your patients. So all these are so-called the why you need a wet lab. But at the end also, the most important thing why you need to go to wet lab is should be part of your logbook. Your logbook is basically at the end, will become a ticket to show that you're already prepared to do the surgery under supervisions by your seniors and also the lecturers and also all the specialists, okay? So you should know nowadays, the condition is totally different. Maybe last time, there are too many patients, or senior surgeons may not have time to operate on the patients, so they need to train you very early. Without going to Wetlab also, they will train you to start the surgery AD to do on the patients because they need you, okay, to help them to do the operations. Nowadays, different conditions, okay? You have not many chance of the operation. You need to be prepared on this one, okay? One thing is because also there are many of you as a trainee now, okay? So among all the trainees that, and in case that in the one operation days, there will be 1 or 2 teaching cases, okay? Who will be the one that will be okay for you to start to learn your step, okay? You need to show us that you already prepared, okay? So show us your logbook that you already went to the lab, supervised by some of the seniors, okay, registrar or even the lecturers, okay? You're able to perform to adjust your microscope well, you're able to perform some simple CCC procedures, okay? And also even you're able to bend your needle, able to insert your IOL, okay, that you already done in the lab. Then become your ticket, okay, for you to have a first step in the OT, okay? So I think that will be a very important point, okay? Whenever you go for a wet lab, okay, keep your logbook as well, okay? When you go to OT, when there is a chance, okay, the lecturer will always ask you, hey, can you show me your logbook? Whether you have done any previous wet lab or any bookshop before. It's also good for us to know that where are you, so that we know that which step that we should let you try first. The other thing is who should you approach to go to your wet lab, okay? Definitely, yeah, you can always ask for the lecturer, okay, and your consultant and specialist. If you don't mind them and Mbebe for whole days before start teaching you anything, okay? I like Mbebe, so don't look for me. Yeah, then the next thing is you can look for the seniors, okay? Your dear seniors that later going to give you orientations. Don't worry about the picture, they are not so bad. They are worse than that, okay? But the seniors always will be a good friends for you, especially those more senior registrar, okay? They are very free, they already passed their exam, so they are willing to teach you from some basic steps, including the suturing, whatever, okay? If not, can always look for your friends, okay? So each of us also come in to join master in different level. Some may have a more surgical experience before. Some may have no ophthalmic experience as well. Don't worry, okay? So as a friends who already have some experience, utilize them to teach you the step that they know, okay? So that you know that you're able to pick up the skill as well. If none of the human want to entertain you, just then go to the YouTube, okay? YouTube, they have a lot of information to teach you step by step how to do a suture, how to start with some incisions, how to do some CCC step. Watch more videos, okay, before you go to Wetlab, only if you really have no one to go with you. But to remember that, yeah, you should have someone to supervise you, okay, because the Wetlab is supposed to be a protected environment, okay, and also to make sure that the equipment, everything inside is safe for you as well as safe for the next user, okay. So when can you go to Wetlab? Basically anytime, yeah, 24 hours, 365 days, okay, as long as you have the key in the department. But important thing is they must inform someone, okay. You either can inform any of your supervisor or lecturer, okay, any lecturer or the registrar in your team, okay, to go to the wet lab, okay. Suppose there will be a record book, what time you enter and what time you end. Except that you need specific instrument, okay, for those who are more senior, then need to go for the Kitalo set, okay, then because the set itself is quite expensive, okay, so they will be kept by some of our PPSP and some of the lecturer, so you can approach them as well so that we know who is using that, okay. But always remember safety first, okay, and always have to make sure that you target the cleanliness of the wet lab as well. The next important thing is how can you utilize the wet lab? You go inside, you have no idea, you just look at the microscope, whether that is helpful for you or not, okay? So in wet lab, I can tell you that there are many things that you can do in the wet labs, okay? So as simple as start with some suturing. I think most of you will start with some, you know that at the end, from the beginning, you may do some pterygium surgery, okay? And also acute surgery as well that you require a lot of suturing, okay? So how do you do surgery? Okay, in our wet lab, I can tell you that we have all the functional microscope and all the microscope have a teaching piece as well. You can, the senior or the whoever that teaching you can have a look. So these are the general setting. Okay, last time I used to bring them to see all these things, then they know that how to set. Basically, all these things is by your creativity. Okay, you can use a banana skin, whatever thing that you think that the feeling of it is quite similar to the eye or even the eyelid surgery or whatever. Okay, then you can do a suture. You just make a nick there. Okay, and then you do a surgery. The most important thing here is from the beginning, you need to familiarize yourself with the microscope. Okay, how to coordinate your eye and also your hand and also leg at the same time as well to adjust the microscope. Okay, so we have all the instrument ready in the wet lab as well. Suturing set, definitely it's ready there, even though may not be complete and may not be so many sets available, but you can always use them. They are there waiting for you. So the next step after suturing done, suturing basically is something that is the safest, but suture should come with price as well. Most of the time, we have a lot of suture there that either is expired already or donated by the company. Okay, so you can always utilize that until finish all. Then only we look for a way to get a new suture, whatever. Okay. So the next thing that come will be you think that you already done the suturing, is quite familiar already. You want to go for next level, then you can start so-called the lens surgery, which is the common surgery that we are going to do in the future lah. Okay, so initially then you can do with the, I believe you all have heard before, sometimes you use animal eyes, okay, the goat's eyes or whatever to mimic the human eye so that you have the experience to how to operate this, okay? So you need to know what is the instrument for you to use it, to utilize the goat's eye. Don't just buy a goat's eye and then just cut it, then you do know at the end you have no benefit from it, okay? So in the Wetlab also, we have something called as the eye stabilizing device, okay? It's called as a Mandel, okay? So basically, they use a vacuum, okay, to create a vacuum to suck the eyeball that you purchase from wherever, okay? So then you make the eyeball more firm for you to do a key surgery. To practice to do a key surgery will be a very good platform for you to do a key surgery. At least you know how to do a cornea incisions, do some suturing, okay, on the cornea as well. So the other thing is, in case you cannot find this or this thing is not functioning, you can just do a simple thing just to pin the eyeball on the surface, okay, so that you can have a firm eye for you to operate on, okay. The most important point in the Wetlab, definitely at the end, none of the animal eye or even the artificial lens and also eye model is similar to the human eye, okay. But the coordinations that you're able to learn and also to achieve by going to the Wetlab with all these procedures, you will know that you make you difference compared to those who never attended the Wetlab before. So the next step after you're able to do animal eyes and anything, okay, there are something that is more economic, but you require to use a set, okay, a Wetlab set. So this is a famous Kitalo set, eye set, okay. Kitalo eye set for us to practice intraocular surgery, okay. Most of the time, when we do a phaco investigation, definitely you know that you need a phaco machine, okay? Phaco machines in our Wetlab is so far is not functioning, okay? That's why a phaco machine also have a lot of disposable items that you need to use, okay? But without the phaco machine doesn't mean that you cannot practice your phaco emulsifications, okay? You can always practice the CCC and even the can opener, okay, to the Kitalo set. Okay, these are basic instruments that you need to use, okay? I just show you. So that the capsule here is it's just a normal capsule, okay? They come with price as well. So put in a capsule there, you can practice your CCC and also the can opener, capsule resist many times as well, okay? As long as the thing is there. If not, then you can always purchase it by yourself, okay? Because the instrument is free, okay? As long as you're not going to spoil it, okay? You can always use it. The other thing is more economic way, okay? This picture from the Unimas that you know that we can always use so-called the boy dormetor, okay? To practice your CCC. One dormetor, I'm not sure how much actually, 2 ringgit or 3 ringgit, then I can practice 100 of CCC there, okay? Yeah, definitely the feeling of all this CCC is much better if you use Kitalo eye, because Kitalo eye actually will mimic the movement of the eye when you use the instrument, okay? So that at the same time using a Kitalo eye, you're able to familiarize yourself with the instrumentations as well, okay? So the next step, wow, that will be very nice. Over here, there's a phaco machine, microscope, all the lens ready for you, all the instrument ready for you, and also the Kitalo with the artificial lens inside for you to do a phaco emulsifications, okay? This is so-called the ideal setting for you to practice your phaco emulsifications surgery, okay? Unfortunately, we have no phaco machines, okay? So the rest, usually most of the time, we're able to get from our industrial partner. They're able to give us some expired viscoelastic, the braid, okay? The lens material in the Kitalo set is disposable item, okay? It's not cheap as well. So this one also, you can always purchase it if in case you want to do a practice on the Wetlab. Besides whatever mentioned regarding all the common surgery, in the Wetlab, the other thing that you can always do is using a microscope, learn how to bend the needle. As simple as bending the needle, sometimes will really make you stand out of others that you already know how to do it, okay? How to do the lens as well, okay? Don't even know how to do the lens, but you say that you want to go for the sculpting or something like that. No, usually we always teach you and start you from the step behind, who is a very safer step. Okay, so you already show us, you can load the lens quite well, everything able to implant the lens. Okay, then much easier for us to bring you to the next step, next level as well. Okay, and very important, even though not 100% you're able to achieve, is always know the principle of the instrumentations. I always emphasize this is the most important thing for microsurgery, okay? So always know the principle of the pivoting your instrument, okay, how to handle your instrument and also manipulate instrument when you are inside a very close and small space. So the other thing that beside all the cutting inside the intraocular surgery, okay, sometimes you can do some simple thing as well. This instrument, you can learn how to use it for the cornea gluing, okay? I didn't talk in the details. Most of the time, you can always Google how to do certain procedures in the wet lab. They always have a different, very creative idea, okay? Even you yourself can come up with some creative idea and try in the wet lab. Yeah, there will be no harm, okay? As mentioned, there will be a safest environment and also risk-free environment for you to practice your surgical skill. In case that you need any help, like you need some instrument that you're unable to get it, you can always come to us, okay? Because sometimes we have some industrial partner that sometimes willing to provide us some material as well. The next thing also, there are other established wet lab as well by certain company, okay? Sometimes you can make your effort, okay, to make a good friend with them, okay? Sometimes you can utilize their environment. So they may provide you with a freelance, okay? Free guitar set to use during the wet lab session in their company as well, okay? This will be another option as well, as long as you understand the importance of wet lab and also what to prepare before you attend a wet lab. Okay, that's all for my presentations and also the briefing. Welcome on board. Okay, hopefully you all have a wonderful journey as a master student and also will become an ophthalmic surgeon in the future.